Hello, everyone. We are here back again with yet another engaging and a very interesting interview. And I'm very, very happy to introduce Dr. Sanjay Gupta. I am his fan. I've been watching his YouTube channels, and then I happened to see a video, and I kind of resonated a lot with whatever that he was saying. And then I thought, let me reach out to him because he sure has a lot of things to share with all of us. And I have a lot of questions also lined up. Anyways, Dr. Sanjay Gupta is the consultant cardiologist at the York Cardiology in UK. Having spent nearly 3 decades in medicine, he feels that the healthcare industry rarely ever provides healthcare. Instead, it provides disease management by using expensive and potentially harmful pills to mask symptoms. But then he's not anti pharma. He understands that it needs to have a good balance of both lifestyle and the importance of therapeutic management. Both are important, but striking a fine balance is equally important. He believes that the lifestyle management is perhaps the single most effective therapy in medicine, and yet largely ignored because it is boring, not as profitable as promoting the newest and often the most expensive tablets. It is his endeavor to provide high quality, reliable, and jargon free information about health at no cost to everyone in the world instead of leaving patients confused and anxious. He uses the power of internet to provide everyone with a high quality, reliable, and evidence based resource for medical information. So he has this YouTube channel called York Cardiology. You probably can Google it up as well. A lot of very informative information is out there. And thank you, Dr. Sanjay Gupta. Thank you for talking to our audience.
Thank you so much for having me. I'm delighted to be with you.
Thank you. So I have a series of questions lined up. And the first question that a lot of people have, I'm sure, in their head is that seemingly a lot of fit and healthy, seemingly fit people who are going to gym, who have put up all those crazy workout videos on Instagram. And we often look up to them saying that they are the beacons or of what health and fitness is all about. And they succumbing to cardiovascular disease. We get a lot of media kind of adds up to that by giving wrong information at times. A lot of wrong information goes in the WhatsApp and the Facebook universities. So we want to hear it from the horse's mouth. Are South Asians really prone to such diseases, or is it because of, is there something inherently wrong with the way we look at health and fitness?
Yeah, I think I think you're quite right in saying that we are beginning to see a spate of young, healthy people, dying suddenly, and it's very shocking. I've been thinking about this for a long time. When I was, when you become a doctor, you feel like you know it all, and as you mature, you start realizing that the only thing you know is that you don't know it at all. So when I've thought about it, I think bad things happen to anyone for 4 reasons. 1, age. 2, genetics. 3, simple bad luck. And 4, lifestyle. The reality is we can't do anything about our age, our genetics, and our luck. The only thing we can do is about our lifestyle. But despite doing everything we can with our lifestyle, sometimes the other things play a role. And therefore, just being very active, being very fit is not a guarantee that a person will live to 100 at all. I think we have to also realize that lifestyle is not just about exercise. Lifestyle is about nutrition. Lifestyle is about good sleep. Lifestyle is about stress. Lifestyle is about being happy. Lifestyle is about being surrounded by people you love and not being lonely. Those are all really, really important things. If you think about it, if you look at older people, what kills most people? Actually, loneliness seems to kill a lot of people. So those are all really important aspects to a lifestyle. Lifestyle is not just about looking really fit. And actually, it's interesting where there's this huge fitness craze now, and that's not a bad thing. It's not a bad thing at all. But to my mind, exercise has to, I think the benefits, of course, everyone thinks, well, you're exercising, you're keeping your muscles nice and relaxed, and you're reducing obesity and all that. But there's something else about exercise which I think is really important, and that is that true good exercise is a meditative experience. You you switch off and you are able to blank out everything and just enjoy it for the pursuit. However, when people go too far, it becomes a stressful experience. And that I think is interesting, because when you're trying to achieve some kind of ideal and you're really killing yourself over it, that extra stress, I think, can't be good for us. And a lot of people who sacrifice a ton to get to look like they do eventually end up quite unhappy, because even though they've gotten there, perhaps that isn't the thing that makes them happy. That is the thing that garners attention, brings in the money, etc. But ultimately, peace of mind, quality of life is important. I think also living a life of simplicity, living a life of moderation are so, so important. When I think about it, the bad things can happen to anyone. There is no guarantee. I can be talking to you, next thing I can be dead on the floor. It can happen to anyone. The important thing is your quality of life. Are you living a good life? Because life can end and we have no control over it. And so I always think it is a mistake to say, okay, well, I'm going to do this really hard now, really kill myself now, so that I can enjoy in 20 years' time. You may not have 20 years, and it may not be the way you imagined it in 20 years. So enjoy it now, slow down, enjoy it now.
So you're saying everything in moderation, and you are basically saying that fitness can lead you to health, but it does not necessarily always guarantee health. It also depends upon
Absolutely, absolutely, absolutely.
right.
And the other thing is, of course, everyone worries about their heart, but there are so many ways to
Other
die.
parts, yeah.
So everyone is like, I don't want to have a heart attack. I don't want to have a heart attack. But you can have a virus come along one day and attack you. You can be hit by a car, etc. So improving your quality of life, which is the thing you have some control over. Length of life, really, we don't have control over. Ironically, the thing that stresses most people is the thing we really have no control over. And the thing that they choose to ignore is the thing that we actually do have control over, which is our quality of lives.
Wow, that's a very very well put, and that's very interesting point. So coming back to fitness, so how much is too much? I mean, for a person, let me ask you this: for a person who's just about to start, say around 30 or 40s or mid 30s, mid 40s, and wants to become healthy, suddenly has this realization, especially during the pandemic, when they get caught with coronaviruses, when they think, oh God, let me now become healthy now that this thing is happening around. So for such a starter, what is there a prescribed time amount of exercises? And for
Yeah.
somebody who's already started with exercises, probably in line and doing gymming or doing cardio exercises, is there a time for this much hours in a week or sorts?
Not really. I mean, the various bodies, the various cardiology bodies come along with some recommendation, but who knows whether that's correct or not. What I would say is, I think unaccustomed exercises, unaccustomed heavy exercise is bad. So if your body is not used to exercise and you go in and do something unaccustomed, there is a risk, because a lot of heart disease, when we're talking about heart disease, we're talking about heart rhythm problems and heart attacks. A lot of heart attacks occur because you've got some plaque sitting in your heart arteries. It's not really causing you any bother, but then something makes it drop, fall, and then the body forms a blood clot because it thinks you've sustained a wound, there forms a blood clot. And that is the mechanism of that most devastating kind of heart attack, which is sudden heart attack, sudden death, that kind of thing. And in that sense, unaccustomed exercise is probably something that contributes to that. So wherever possible, I would recommend that people build up always. I think the desire to exercise is exceptionally good, because it is good for the mind, it is good for the body, it is anti-inflammatory, it has all those properties. But I would recommend that you start off with some cardiovascular exercise, and you want to do it in a way that it is a part of your life, rather than say, okay, I'm doing it for an event, I'm going to go crazy, and then I'm going to stop, and then I'm going to just enjoy myself, and then I'm going to go crazy again. And that, I think, that's the other thing I would say, is that I think, yeah, I would say 3 to 4 times a week of sort of a little, half an hour to an hour of walking, running. That's good. You can combine that with some weights, but I wouldn't go more than that. I don't think there's really any merit apart from, just looking good, of going 2 hours, 3 hours, 4 hours in the gym every day. I think that's probably too much, because too much exercise can be inflammatory. We know that. And, there is no shortage of Olympians and people like that who just go through so much, and they all develop heart rhythm problems. They develop weak hearts as time progresses. If you go on the heart transplant, if you go to a heart transplant center, a lot of the people on the waiting list for the heart transplants are actually very, very fit guys who've been athletes all their lives. And suddenly, so a lot more research needs to be done, but I have no doubt that too much exercise can be a bad thing.
Right. Very interesting. You mentioned about the risk factors. So, is it true that South Asians, as compared to rest of the ethnicities, or has this genetics which make them more prone? What does the data say?
Yeah, absolutely. I think there is no doubt that Southeastern Asians have a genetic predisposition and increased risk. I don't practice in India, so I can't give you the exact figures. But when the likes of Siddharth Shukla passed away, I was watching the news, and you have some very erudite professors of cardiology in India, and they were talking about a significantly higher risk genetically by in Southeast Asians. In fact, even those Southeast Asians who have gone abroad and have modified their lifestyles to suit to fit in with the Western lifestyle, even in them, you have a higher incidence of heart disease. One of the interesting things, to my mind, the thing that always bothers me when I see Southeast Asians is the waist to hip ratio. If you look at them, they generally have a slightly more, they have a bigger waist and narrower hips, and so they have that slightly roundish build,
Hormonal
uh,
availability.
and I think that increases the risk substantially. So when people want to lose weight, I say you want to lose weight, but more importantly, that you want to try and change the shape of the body. And that is by concentrating on body fat assessments, etc., and doing more kind of cardiovascular work. Even high intensity interval training is okay, as long as you build up to it. But you want to change the shape. The weight is not as important. The proportions, the body proportions are important, I think.
So glad you said that, because this is something that we keep saying, that BMI is okay, but don't get carried away by it. Also look at your body composition and the body
Yeah,
fat
absolutely.
percent.
Absolutely.
So what are the kind of the test a person can do, say after 30 or 40, uh, as a yearly checkup? Because what we see is that people are they're a lot more concerned about how they maintain their car, but may not give so much of importance, or might not spend 1/10 of it to probably take a yearly or once in a 2-year checkup of sorts. Uh, I understand that there's no guarantee that will 100% will prevent any events, but at least can be substantially reduced if a stitch in a time
Yeah.
saves 9.
I think of all the tests, unfortunately, at the moment, a lot of people concentrate on surrogates. They look at cholesterol, they look at blood pressure, they look at all that. There is a much better test, because all these things are surrogates and they have lots of confounding factors. And we don't even really know. We don't even really know whether they tell us what we want to know. In some way, we measure something, we don't quite know what it is telling us, but if we're bringing the number down, then we feel happy. And so the question, I guess, is what is the best test out there? The worry your clientele at that age have, the thing that is going to, if something bad is going to happen, the most likely bad thing that's going to happen is a heart attack. As a person gets above the age of 35, the thing that usually kills them is a sudden heart attack. And that, I think, is what's happened with the likes of, Siddharth Shukla, Puneet Rajkumar, etc. Now, the question is, okay, well, what is the best negative predictor that something's not going to happen? Now we have CT angiography, so you can actually visualize the heart arteries in a non-invasive manner. And if your heart arteries are completely normal, then that is probably the best negative predictor over and above everything else, that it is unlikely that something bad's going to happen to you in the next 5 years. The problem is what if there is some disease? That is the problem, because it may well be it's not very, very bad, but just having some disease, what do you do about it? Of course, where you can modify your lifestyle, great, do that. But what if you are already leading a good lifestyle? Then what else do you do about it? And the problem is that there's not very much you can do about it, apart from if you buy the kind of, you know, that people talk about statins, etc. But really, apart from lifestyle and maybe statins, but a small benefit, there's not much else you can do about it. So it's good if you have one of these done and you have the normal arteries, you can just relax. It's as good as anything else, and you can just get on with your life. If on the other hand you have a little bit of disease, maybe it does allow you to become a little bit more cognizant of where your health, your lifestyle is lacking. And then I suppose what one could do is repeat it in 2 or 3 years and say, okay, are things getting worse or not? Unfortunately, you can do everything right and it can still get worse. But that would be the way. So for me, the CT angiogram.
Yeah. So this reminds me, when you said that there is a block, this reminds me of the way, something that you discussed about collateral arteries and how exercise being an anti-inflammatory, but a controlled exercise, not like go out and then slog your ass out in gym kind of an exercise. A controlled, sensible exercise can in fact be anti-inflammatory and might even help provide collateral arteries. Can you explain that to our audience as to what do you mean by this?
Yeah, absolutely. I mean, if you think of a highway, okay, and cars are going down this highway very quickly, and then suddenly something falls on the road, there'll be an accident. Okay, there'll be an accident, etc. But if over a number of years you find that the road, there's more trouble brewing on the road, more roadworks, everything, the cars will adapt, so you're not going to get that accident. But the second thing is the cars will find alternative routes to get to their destination. And that's what happens with blood. All blood vessels are eventually connected by tiny, tiny, tiny blood vessels. So if a main blood vessel starts narrowing, the blood will go down other vessels and get to where it needs to. The problem is only when it happens suddenly. If you haven't built those vessels, if you haven't built those side roads over a period of time, then there's a major problem, because as soon as you have the blockage, that bit dies. But if you have other ways by which the blood can get through, you can actually block it, and you can have a minimum amount of damage because the rest of the blood is just percolating through to the destination where it's needed.
Are these collateral arteries built as and when there is a block formed, or are they already there? Because my understanding was that the heart arteries are already end arteries, and they are probably the only arteries which takes up nutrients and blood and oxygen to that muscle tissue. So is this something which is being built when a person does controlled exercise over a period of time?
No, so what happens is that you have the artery, but the arteries are, I mean, you're right in that they sort of go, but they all give up side branches, and they all then have little capillaries going through, and those capillaries will connect to other arteries, etc. So, there is no area of the heart which is without blood, and that even though your vessel is here, you will still have tiny, tiny, tiny branches. Now, these capillaries have the ability to expand. If more blood is coming through to them, they'll expand over a period of time. And they're the things that form that collateral circulation.
Right. Get that, yeah. Hypertension, especially we live in a pressure cooker environment. Thanks to the last 2 years, things have a lot of job changes, environment changing, and that is also adding up. So why is hypertension dangerous, and what are the associated complications which could happen, and how should it be managed?
Okay, so hypertension is a real
topic in itself.
It's a big topic, but it's also, in my opinion, it's quite a poorly understood topic, because what has happened is everyone measures this number, and they say, "Oh, what's my number?" And someone will say, "Oh, it's high," and before you know it, there's chaos, and we have to give you tablets, etc. The first question to say is, well, what is blood pressure? What is blood pressure? Blood pressure is force of blood exerted over an area of the blood vessel. So that's what pressure is, force over area. So either you increase the force to increase the pressure, or you reduce the area. Okay, so how do we increase the force of blood coming out? We increase the heart rate. So if you get stressed, your blood pressure will go up. If you exercise, your blood pressure will go up. If you have lots of salt in your diet, you'll retain more water, more blood will go out. That will cause blood pressure, but that can be a situational thing. The bigger problem is our blood vessels are stretchy blood vessels. So when you exert force, those blood vessels stretch. The area gets bigger, the pressure is less.
Yeah.
Over a period of time, what can happen is that these blood vessels become less stretchy. And therefore, the pressure starts rising. So the true pathological blood pressure is a problem with the blood vessels becoming less stretchy. Now, the question is, well, why is blood pressure important? And there are only two reasons to my mind. One, because it may be a symptom of some underlying process going on in our body, and it's a symptom. Something is going on in our body, we're unhappy, and our body says, I'm going to scream for help by showing this person that the blood pressures are high. Okay, so what are the kind of things that could do that? If we're obese, if we are sedentary, if we have other conditions that cause our blood vessels to narrow, if we are old, all those things. In that setting, it doesn't make sense to reduce the number because you're just damping down a scream for help. You should be tackling what is the underlying problem, right? Then the other possibility is that the number itself is doing you some kind of harm, that the number is harming you. And it's true that if the number is very, very high, then your blood vessels, which are the most fragile blood vessels, will rupture because of this pressure being very high. And when they rupture, they heal by clotting off. So now what the problem is the area has become smaller because these blood vessels were this long, they've ruptured, they've clotted off. So the area is getting smaller, so the blood pressure goes up. And of course, the supply of blood to these vital organs where these vessels have ruptured and healed by clotting off is less and less as time progresses. So in that setting, it makes sense to reduce the number if you think that the number is harming you. Unfortunately, modern day blood pressure management is all about reducing the number. And therefore, the first thing I would always say to people is that when you have high blood pressure or when you are diagnosed with high blood pressure, the first question is, how do we know that that is the number that we're going to take? Because if you measure your blood pressure 100 times in a day, you will get 100 different values. Which one is the one? Which one is the one you're going to use to compare to this number, this magical number that scientists have given you? So I would always encourage people, first, work out what your number is. How do you work out what your number is? Have a 24-hour average blood pressure. Not blood pressures that you measure yourself. Get a machine which will automatically measure your blood pressure twice every hour during the daytime and once every hour at night. And the night BP is very important because that is the time when you're removing all the other confounding issues like stress, exercise, this and that. And you're getting a much purer signal of your blood pressure. And most research that has been done to show us that blood pressure can be harmful has used either a 24-hour average or the nighttime average. Yeah. So getting those readings is so important before you start worrying about the blood pressure, because the worry will increase your blood pressure even further and makes your quality of life worse. So I would always say that, don't let people just put you on tablets. Find out that. The second thing is find out if that blood pressure is high for you, not high per some number, but high for you. How can you do that? Well, you can look at the back of the eyes where you can see the most fragile blood vessels. If there is no damage in the small blood vessels, if you don't see micro bleeding or anything like that, then those vessels have not been damaged by your blood pressure. Same kidneys. Tiny blood vessels in the kidneys. If the kidney blood vessels get damaged, your kidneys will leak out microscopic levels of protein. You can measure that. Unfortunately, most doctors don't do that. They will just measure a creatinine, a blood test. You can lose one kidney before your creatinine goes up. So being more sophisticated about working out, is my number high for me? That I think is really important. And then, of course, the heart is a muscle. If you're working it's working against a higher pressure, it'll become more muscular. You can easily pick that up on a scan. If you don't have those things, then you can be very relaxed that actually whatever my number is, it's not doing me any damage. And then the third thing I would say is that, of course, then it's a good idea to look and say, well, how can I become a healthier person? Because if you become a healthier person, your blood pressure will drop by itself. So things like weight, for every kilogram you lose, your blood pressure comes down by 1 to 2 millimeters of mercury. If you have sleep apnea, 1 in 5 people in the Western world have sleep apnea. So they stop breathing at night. And the amount of stress hormones that are going up at night are so big that they have a catastrophic effect on the person's health going forward. So picking up stuff like that would be helpful. And then eventually, if you've done all those things, your numbers are high and they're high for you, then one could resort to tablets, because the tablets are only making the number look prettier. They're not making you a healthier person.
Right. The tablets are making
Lifestyle makes you healthy.
prettier, but not making a person healthy. You're basically not fixing the root cause of the problem.
Absolutely.
You're managing it and making the number look prettier for you. Yeah, makes sense. Talking about diabetes, I mean, I think that is a real pandemic out there lurking in the dark, creating a lot of issues in future. How is that related? How does that lead to, and what is the probability of it leading to cardiovascular diseases and damages?
Well, this is very interesting because there's no doubt that people who have diabetes, type 2 diabetes, are at a higher risk. There's no doubt about that. This is a well-proven thing. The question is, what is type 2 diabetes? What is type 2 diabetes? And the problem is everyone thinks it's a condition of sugar. Okay. And the idea is that, okay, if your blood sugar hits this value, you're diabetic. Okay. And if it doesn't hit that value, you're not diabetic. And this is how modern day medicine is being practiced. When you look, actually, you find that, if a significant proportion of people who are diagnosed with diabetes have already developed the damage associated with diabetes, even at the time, on the day of diagnosis, they've already had that.
Yeah.
And what happens is you get diagnosed with diabetes, and then they say, okay, take these tablets to reduce the blood sugar, the value that they measured, which was high, let's reduce that. And so the person takes anti-diabetic pills. And what is the reason? Well, because bad things can happen to you if you have diabetes, we need to make the number down. 10 years down the line, the person comes with a heart attack. So they say, well, why did I have a heart attack? They say, oh, you're diabetic, that's why. So what were you treating the diabetes for if the person is still going to have, and we see it all the time. We see all these diabetics coming in with heart attacks who were diagnosed with diabetes
and already
who were on treatment for diabetes. So there is something wrong here. And very interestingly, there were some studies now which have shown that actually the current management and control of diabetes doesn't even seem to make a difference in the outcome in the long run. So the problem is, A, we are not tracking the right thing. And B, we are not managing it correctly. And now what I think is going on, and there's this theory about something called insulin resistance, which you will have come across. And the way I understand it is that what the big problem now is sugar. Sugar in the diet, sugar everywhere, sugar in everything. And all the refinement and artificial sweetness, etc. And what is happening is people are getting a sugar hit every time they take sugar. And what is probably happening is that their pancreas is working because they have to produce insulin so they're getting lots and lots of insulin spikes. And it is believed that maybe the insulin chronically being spiking like this is probably what is potentially doing the harm. So now what is happening is your pancreas is working overtime, producing all this insulin to beat these sugar spikes all the time. So your blood sugars remain low because you're producing more and more insulin. So you're not diagnosed as diabetes, but you have this process going on in your body, which eludes everyone because they're looking at the wrong thing.
And your body's still inflammatory while the numbers.
Of course, your pancreas is working, your sugar numbers are fine. You are happy that there's no sugar, but this is going on in the body. And then by the time the pancreas stops producing the amount of insulin you're needed, then you are diagnosed with diabetes. But that may well be the reason why so many people have already developed the complications before they're diagnosed with diabetes. So again, and when you look at it, the same things are seen. diabetes, high blood pressure, fatty liver, dementia, sleep apnea, obesity. They all are part and parcel of one process which is going on. And I think they're all brothers, and what we've done is we've always made the mistake of thinking, oh, this is the parent. This is the parent of this, so let's kill the parent and this won't happen. Maybe they're not. Maybe we're missing the real parent. Maybe we're just killing one brother, trying to kill another brother, etc. And the parent is me. Because again, with blood sugar management, if you're just controlling the sugar, you're not tackling the underlying process. And some people say that now, in type 2 diabetes, they give insulin, right? And maybe if insulin was actually the thing that was contributing to the problems.
Yeah.
And it's very interesting because now glycoside, sulfonylureas, which are used in diabetes, now they're beginning to find that there's a higher risk of dementia in those patients. Very interesting. So I think it's suboptimal. And I would, again, through programs like yours, I would encourage people to become more informed, because doctors like me are servants to the pharmaceutical industry, servants to some self-appointed expert who will then produce some guidelines and tell us how to practice medicine. So everyone relies on us to tell them, but actually we're just told by someone else. And people now in this age of the internet can do their own research and can start questioning why, if we are so good at all these things, why are so many people dying of heart attacks? If we are so technologically advanced, if we can do so much, why aren't we making a dent? In fact, heart disease is on the rise. Younger people are getting heart attacks. And I suspect it is because of the adulteration of food. And I think it is because of the stress that we are put under.
Wow. A lot of things that you said. You mentioned about being self-aware and learning and understanding. And but that also comes with a little bit of, again, a lot of sense and common sense being applied, because looking for information on the internet is also like looking for a needle in a haystack. And that's why channels like yours, which talks about stuff, which takes me to the next question, magnesium. I've seen you speak about it. I found a lot of this information very interesting. And I think if we can I think we're coming to the last question. Just after this, I have one last question and then I'm done.
Sure.
Can you talk about magnesium and why should one worry about magnesium? And
yeah, my interest in magnesium stemmed from the fact that about 7 years ago, when I started doing my videos, I did a bunch of videos on heart palpitations. Okay. And you wouldn't believe how many people came to me complaining of heart palpitations that have been going on for years and years and years. And the doctor's giving them one tablet, another tablet, the palpitations aren't stopping. Then these people say, doctor just says I'm anxious. He doesn't want to have anything to do with me. Go away. My medicines don't work. And my life is just not worth living because every time I do something, I get skips, flutters in my chest, etc. So I started getting interested in that. And I thought, well, yeah, but the medicines that they've been prescribed are the only medicines I have. There's no, he's been given what I would give him. So during my research, I came across a video by a patient who had put a video up and said, look, the thing that really worked for me was magnesium. And I got interested in that. And I said, oh, maybe I'll recommend it to a few of my patients. And lo and behold, the majority of them came back and said, I'm so glad you recommended that. So the more I started reading about it, it became apparent that magnesium is deficient. So in our diets, there's a lot less magnesium, and that's probably because of the way food is made these days. Food is grown, so it's fertilizers and pesticides and processing and all that kind of depletes magnesium. Secondly, I found out that magnesium is very difficult to measure, so the blood test that we use is not very good. Thirdly, I found out that magnesium has lots of interesting biochemical properties in lab studies. So it's an anti-inflammatory, it's an anti-dysrhythmic, it is a vasodilator, it's a blood thinner. So there were really nice things about it that made it an attractive compound for people to use. Also, I realized that it's actually not a harmful compound at all. So you can take quite a lot of magnesium and not come to harm. And when you are taking too much, you get diarrhea. And so it comes out of you. So it's in general interesting. And then it was my own experience looking at patients and saying, okay, well, when someone comes in with a bad asthma attack, we give them magnesium intravenously. When they come in with heart rhythm problems, we give them intravenous magnesium. And I started using it just as a supplement in my patients. And I would say 8 out of 10 people will come back and thank me that they started on magnesium. Somehow, somewhere, their quality of life gets better. Some say, I sleep better, I get less restless legs, my heart palpitations are better, my anxiety has calmed down. So I think it's a low-cost medication, low-cost, low-risk, and relatively natural. And does seem to improve.
Is this a supplementation? What is
it's supplementation? It's a supplement. It's a supplement.
Is that something somebody can have? Should a person go get an recommendation from a doctor before having this magnesium supplementation?
Well, I don't. I mean, I've not come across anyone who can't have it. The problem is a lot of doctors will say, oh, there's no evidence, or no, you're not going to do that. In fact, I wanted to share a very interesting story with you. I know we may be short of time, but it's interesting. Where I practice, I sit with another colleague who's a very intelligent, experienced cardiologist. And one day I was scanning one of his patients who was having heart palpitations. So I was scanning her, and she mentioned these skips and flutters and thuds. And she was not my patient, I casually said, have you ever tried magnesium? And I forgot all about it. And then 1 year later, she came to see me. And I said, how come you're here to see me? And she said, you remember you told me about the magnesium? And I said, yeah, great. And I said, what's going on? Why are you here? And she said, oh, these skips, these flutters, these palpitations are terrible. And I said, did you try the magnesium I told you to? And she said, yes, I did. And I said, and she said, they went away completely. I was so happy they went away. So I said, what happened then? She said, I went to see your colleague and I told him about this. And he took my pills and he threw them in the dustbin and he said, it's all in my mind and there's no evidence that they work. And I said, okay, so then what happened? And she said, then they started back up again. So I said, what evidence does he need? What evidence does he need? You're the only person that matters, as far as you're concerned, as far as that doctor-patient relationship. You are providing that evidence. You are saying that when I took these, I felt better. When you stopped these, I got worse. That's all that you need. So they do work, and I think I would encourage people to try a magnesium supplement.
This would be magnesium glycinate.
Magnesium glycinate, magnesium citrate, magnesium taurate. The only one I wouldn't recommend is magnesium oxide. It is the cheapest form of magnesium, and it just causes the magnesium to come out very quickly. So only 4% of what you take in will be absorbed. So it's better to take a more absorbable magnesium.
Right. This takes us to the last question. We live amidst the pandemic. So as I earlier said, I've seen of people who have not given much of a thought into their health and wellness. And then when they get COVID positive, that's the time that they think, oh, I need to start exercising. And as long as their RT-PCR turns negative, the very next day they are out in the gym or wanting to go for a run or things like that. Post-COVID tachycardia has been increasingly common. I've seen a lot of clients coming to us with very high heart rate. And these were all marathon runners or long-term cycling enthusiasts having this tachycardia-related issue. So somebody who's used to do a lot of cardiovascular exercises, getting this. Why again, this is something that you already mentioned, that to pace your exercises and not to overdo it. And overdoing anything is bad. Even the world's most healthiest food, if you eat more than what your body needs, triglyceride levels will shoot up. Same as with exercise, inflammatory, all these things you touched. But when it comes to post-COVID tachycardia, what does that mean? No, as of I know this is a relatively a new demon, and we don't know about it much. A lot of information still coming. But what is that you can share to our people with regards to COVID and related heart-related care?
Yeah. So there's two things. One, this is common. Now the question is it about COVID? Or is it that the infection by COVID has unmasked a problem in the patient? And that's very important to distinguish. And the reason is that, of course, if you get hit by COVID, it does all sorts of stuff. It causes lung problems, it puts the body under a lot of stress. It leaves the patient very anxious. It knocks people out. And when they come back, they're a little bit more deconditioned. So all those things could explain the tachycardia. However, there was an interesting study looking at patients 12 months post-COVID. And up to 10% were not able to resume their normal job. Okay. No, not 10%, sorry, 10% of long COVID patients were not able to resume their job at 1 year. And it didn't appear that there was a good relationship between how severe your COVID was and whether you got this problem or not.
Mm-hmm.
So I think that the whole of this long COVID, which is what you're referring to, post-COVID tachycardia, et cetera, dizziness, brain fog, et cetera, I think it's a heterogeneous population. I think there are some people who probably had bad COVID and therefore still have some residual effects. The lungs have been affected, et cetera. And I really think that those people who have been very badly affected will be left with some long-lasting damage, because you can't have something that just completely affects your oxygenation, less oxygenation to the brain, people who've ended up having to have extra oxygen, ventilation, etc. I'm sure that there is some of that, but there is another set of patients who have something called a post-viral dysautonomia, and this is something that we have seen in other viruses, so Epstein-Barr virus, other coronaviruses as well. And what they're left with is that there is something about that patient, which is a genetic vulnerability, which means that the balance between the flight and fight and the rest and digest system is a little bit more vulnerable. Then when you come along and you have a virus like this, it upsets that balance. And so what these patients do is they end up having more flight and fight and less rest and digest. And therefore, they will complain of heart rate going up, temperature dysregulation. When they stand up, they don't like it. It's like they're on adrenaline, their legs start trembling, and they don't rest and digest. So that is a post-viral dysautonomia. And we know of post-viral dysautonomias in the past that we've been managing. One of them is a condition called POTS, which I see thousands and thousands of people with. Now, the problem I have is that POTS you can use medicines for, and people can get better. Long COVID, because doctors may not necessarily make the connection between long COVID and a post-viral dysautonomia like POTS, they'll say, oh, there's no evidence for this, just continue, slow pace, rest, that kind of thing. We have to be more astute and look at what works in these post-viral dysautonomia patients like POTS and try them in the long COVID cases, and some of them will get better. And I've certainly done that in my practice, and many of my long COVID patients have responded to treatments that I would give for other post-viral dysautonomias like POTS.
Very interesting. So it would also mean that don't go out and start running 10 kilometers and things like that. Pace yourself.
Because the problem with that is that with this kind of thing, if you do that, you'll be able to do it, but it'll lay you out for 3 weeks after that. And then you become more deconditioned. So when you want to try and recover, do it very gradually, do a little bit. I'd much rather someone ran for 5 minutes every day and kept that going, rather than running for 1 hour on one day, not doing anything for 3 weeks because you feel so dizzy and your heart rate shoots up and you feel just tired, etc. So that, I think, is important. Build up very gradually.
All right. So from whatever videos that I have seen on your channel, I realized that all good things in life takes time, and live a life which is also about happiness, and don't take it for granted. And everything in moderation. And while things are not predictable, you might have a healthy heart, but a person can succumb to a traffic accident, or might have a cancer growing or whatever. So also enjoy and then make the fullest out of whatever that we do. And that's what is at the end of the day important, right?
I agree. I mean, we're sold this idea, aren't we, that you're put on a hamster wheel and you're just made to keep going. Happiness is around the corner. Buy this. And when you buy this, you'll be better and you'll be happier. And then when you buy this, they'll say that, oh, keep going, buy this and you'll be happier. And
It's like a
eventually
rat race, but even the
exactly.
one that wins is still a rat.
Exactly. And the other thing is that the problem is that what ends up happening is we start accumulating material wealth. And actually, that makes us lonelier and more isolated because we surround ourselves with material things and we don't really get to do those things which actually truly bring joy, like spending time with our loved ones, like investing in ourselves, growing. So we rarely get that, but that those are very nourishing things. When you're investing in yourself, in your education, in with your family, etc. So I would always encourage people to say those people who say, I want to live. I don't want to die yet. I want to be there for my children when I am 50 or 60. I would say be there for them now. That is the important thing. Be there for them now.
Because tomorrow you never know what is in store.
You'd never know. You never know. Absolutely.
Thanks a ton, Dr. Sanjay. I mean, it's a pleasure. And I truly do consider this as my privilege to having had this discussion with you. Thanks a ton. And for all the viewers out there, I urge you to go and then check both the Facebook and the YouTube. I think YouTube has more videos put up.
Yeah.
Right.
About 300, I think 300 odd videos.
Do you take online consultations also?
Yeah, I do.
You do. You take consult. And is time a problem, or is it only from the UK patients that come in, or
No.
from India?
No. I mean, yeah, I think I felt very much that there was a shortage of that person that you could just go and talk to, who can give you just information in a comfortable environment, which is not hurried, where you're not looking at the clock and the money is not building up and all that kind of stuff. I think there's a real need for that, just having a chat with someone who can help you navigate around healthcare. So that's what I do. And that I think I find it very enriching for myself. And I think a lot of patients also find that there's an unmet need there.
Absolutely. I said that I'm actually going to interview you, and one of my friends said that, wow, let me know in the videos. Thanks a ton once again, Dr. Sanjay, for spending time with us. Thank you. Thank you, everyone.